I spoke to Dr. Jennifer Brett. She's the founding director of the University of Bridgeport Acupuncture Institute, and I asked her about the growth of acupuncture programs in the U.S.
I started in 1980, graduated in 1988. Since then, there have been a tremendous growth in programs. There are now over 60 programs training people to become acupuncturists in the United States. Back in the 80s, there were just a handful. This is no doubt due to the prevalence of using acupuncture for pain, which is a common complaint. And acupuncture is effective, so we see lots of people looking for acupuncture services. More insurance is covering acupuncture services, so therefore more demand for acupuncturists.
Are you surprised by that growth?
If you'd asked me in the 1980s whether we'd have 60 different programs of acupuncture in the United States, I probably would not have guessed that much growth. But seeing the growth in healthcare in general and in alternative medicine like acupuncture in the United States, looking back, I could see that that growth was likely to happen.
We know that the end goals are the same, but what are the biggest differences between programs here in the United States compared to those in China in terms of the type of the training, approach, even treatment?
Well, in China, acupuncture starts out at a bachelor's degree level, and then you can move up to a master's and doctoral degree. In the United States, it's at the master's level is where licensing occurs, although some people do go on to get doctoral degrees in Chinese medicine. The focus in the United States is on much more individualized training and individualized treatments, whereas in China they have much larger programs with much larger classes of students, and they focus more on treating common diseases with acupuncture, moxibustion, cupping patterns instead of individualized treatments regimented for the person at whatever age or whatever condition they're in.
Well, describe the typical student that you see. What has inspired them to learn acupuncture?
I'm not sure there is a typical student, but many of our students at the University of Bridgeport are second career individuals. They started out maybe in healthcare, but maybe in accounting or maybe in business, and they've experienced the wonderful effect of acupuncture Chinese medicine and are looking to change their life by utilizing that as a treatment modality for themselves, their friends, and their patients down the road.
Do you think there should be more cross-training between programs in the U.S. and China? We hear about acupuncture students or practitioners that have never been to China. Should they go for better insight?
Our students have the opportunity to go to China for 2 weeks every summer to Liaoning University of TCM in China. And those that do take advantage of it and come back are significantly more impressed with the breadth and depth of Chinese medicine that they see practiced in the hospitals there than in outpatient clinics here in the United States. So I think it's a wonderful way of connecting with the medicine, with the culture, with a different approach to Chinese medicine that is more hospital-based. And they get to see how much better people with more severe illnesses get in China when they compare that to the more what we call ambulatory patient here in the United States. So yes, I think that many students should go there, but you can train without going to China. I never went to China until I was in practice for 15 years, so you can certainly do well without going to China, but I do think it's an exceptional opportunity for students.
Dr. Jennifer Brett, thank you so much for joining us.